Why might we have a need to plan out new curriculum? There are several reasons, and something new might need to be taught. The medical field is constantly changing, and new treatments, technologies, and procedures are often being developed. These new elements may require additional education and training. For example, there may be a new surgical technique that a team needs to be trained on, or someone might have a passion project that introduces something new into the curriculum, like feeling strongly that learners need to know more about palliative care. Also, there might be a need for improved performance in a particular area. As part of continuous quality improvement, you might discover that there's a procedure that isn't being followed, or something is lacking somewhere in your program, and you determine that new training or education is needed. For example, in a medical school, you might see that the students are scoring poorly on the USMLE, and that could cause you to evaluate your current curriculum and determine that changes are needed. Next, there are new technologies being developed all of the time, and as they become available and go into regular use, healthcare providers may require additional training. You may also decide that this new technology is so commonplace that it should be used in medical school curriculum. For example, when simulation centers were introduced, training needed to be given to have faculty understand how to use them in teaching. And you might have an innovative classroom space that is developed. Your institution perhaps has invested significant amounts of money and resources into creating this cool new innovative learning space. You may want to develop some curriculum so that your faculty can adapt to the opportunities that are now available because of this new technology. Also, there might be new standards that have come into play. A licensing body could change their competency requirements, so now you have to teach something that you weren't teaching before.